If you have clicked this video, please do not skip any part because lots of useful information coming your way. Anavar, at 150 milligrams per day, represents one of the most reckless and dangerous dosages of oral steroids used in bodybuilding and athletic enhancement. This amount pushes the compound far beyond its therapeutic origins and even exceeds what most professional athletes would consider a heavy cycle. At this dosage, Anavar transforms from a relatively mild performance-enhancing drug into a systemic toxin that ravages multiple organ systems while producing dramatic but temporary physical transformations, muscle growth, and physical transformations. At 150 milligrams daily, Anavar produces muscle growth that borders on the freakish. Users typically gain 15 to 20 pounds of scale weight in the first 3 to 4 weeks, though much of this consists of intracellular water and glycogen rather than pure contractile tissue. This comes from Anavar's unique combination of nitrogen retention, collagen synthesis, stimulation, and complete lack of estrogenic activity. However, these extreme physical changes come at an equally extreme cost to long-term health. Bilirubin levels rise so dramatically that clinical jaundice becomes inevitable, with users developing unmistakable yellowing of the skin and eyes within weeks. Lipid profiles become so distorted that they resemble those of lifelong hypercholesterolemia. Patients. HDL cholesterol often drops to unmeasurably low levels, while LDL cholesterol exceeds 300 milligrams DL. This creates an atherogenic environment that accelerates plaque formation at a rate normally seen only in genetic lipid disorders. The drug's ability to shuttle nutrients directly into muscle cells becomes so pronounced that even with mediocre training and nutrition, users experience growth beyond their genetic potential. Hematocrit levels frequently surpass 60%, turning blood into a sludge-like consistency that strains the heart and dramatically increases stroke risk. Echocardiograms of long-term high-dose users show severe left ventricular hypertrophy and early diastolic dysfunction, precursors to heart failure. The hypothalamic pituitary testicular axis becomes so suppressed that recovery may take years if it happens at all. Testicular atrophy is rapid and severe, with many users reporting testicles that disappear into the scrotum within weeks. The psychological androgenic effects include extreme aggression, hypercompetitiveness, and in some cases, full-blown steroid psychosis characterized by paranoia and hallucinations. The muscle quality at this dosage takes on an almost synthetic appearance and naturally hard, dry, and striated, even at higher body fat percentages. Liver toxicity and hepatic failure risk. Basal metabolic rate increases by 800 to 1,000 calories per day. Forcing users to consume enormous amounts of food just to maintain weight, the drug's effect on renal function exacerbates these imbalances, creating a perfect storm for metabolic crisis. Androgen receptors in the brain become so oversaturated that users experience extreme mood swings ranging from euphoric mania to debilitating depression. Sleep becomes nearly impossible without powerful sedatives. As the drug's stimulant effects on the CNS prevent normal sleep architecture, however, the drug simultaneously causes severe insulin resistance, creating a paradoxical state where users are both constantly hungry and unable to properly utilize nutrients. Many users develop a hypomanic state characterized by grandiose thinking, reckless decision-making, and complete loss of risk assessment. Cardiovascular changes become permanent, with autopsy studies of former steroid users showing coronary arteries resembling those of 80-year-old lifelong smokers. The endocrine system often never fully recovers, leaving users with permanent hypogonadism and infertility. The withdrawal phase brings even worse psychological effects, with many users reporting suicidal ideation when attempting to discontinue use. The body becomes so dependent on the synthetic androgen that natural systems begin shutting down permanently. Many long-term high-dose users find they can never feel normal without pharmacological assistance, effectively sentencing themselves to lifelong hormone replacement therapy. Portal hypertension develops rapidly, with many users showing early signs of liver fibrosis after just 4 to 6 weeks. Cortisol levels become chronically elevated while thyroid function becomes suppressed, creating a metabolic environment that paradoxically limits gains despite the massive androgen load. The adrenal axis becomes so dysregulated that many users require medical intervention to restore normal function post-cycle. Acne develops into severe cystic eruptions that cover the back, chest, and face, often leaving permanent scarring. Male pattern baldness accelerates at an alarming rate, with many users losing 30 to 40% of their hair in a single cycle. The risk of acute liver failure becomes very real, particularly when combined with alcohol, other medications, or pre-existing liver conditions. The hepatic stress at 150 mg daily becomes life-threatening. Liver enzymes routinely exceed 15 to 20 times the upper normal limit, indicating massive cellular damage. At this dosage, Anavar causes direct hepatocyte apoptosis, leading to patchy necrosis visible on advanced imaging. Cardiovascular catastrophe. Anavar's impact on the cardiovascular system at 150 mg daily is nothing short of catastrophic. Blood pressure routinely exceeds 180/120 mmHg, pushing users into hypertensive emergency territory. Endocrine system annihilation. Natural testosterone production shuts down completely within days at this dosage. Unlike with testosterone-based compounds, the lack of estrogen conversion means users don't experience water retention or gynecomastia, but they face equally devastating endocrine issues. Androgenic side effects at toxic levels. The DHT-derived structure of Anavar creates devastating androgenic effects at 150 mg daily. Body hair growth becomes excessive, with many users reporting thick hair appearing in places they never had hair before. Metabolic and nutritional mayhem. Anavar at this dosage creates a hypermetabolic state that borders on pathological. Electrolyte imbalances become life-threatening at this dose. Potassium and magnesium levels drop dangerously low, leading to muscle cramps, cardiac arrhythmias, and in severe cases, respiratory muscle paralysis. Neurological and psychological damage. The neurological impact of 150 mg daily Anavar is profound and often terrifying. Cognitive function shows paradoxical effects, while focus and motivation in the gym increase. Higher reasoning and impulse control often deteriorate to dangerous levels, the inescapable biological debt. Perhaps the most frightening aspect of 150 mg daily Anavar use is the biological debt it creates. The liver damage accumulates silently but inexorably, with many users developing cirrhosis decades earlier than alcoholics.